Okay, I think we're going to get started. If everyone doesn't mind, if it could see your smiling faces. Hopefully you're smiling today. It helps to talk to actual people. Thank you all. So can everyone hear me okay? Give me a couple of thumbs up to make sure everyone can see me. Okay, good. Everybody good to go? Got their cameras ready? You're okay. So I'm Matt Kelley. For those of you who don't know me, I'm health officer with Gallatin County. On Fridays, we tend to get a significant number of questions, some related to the surveillance report. We had a really high number of cases reported this morning from yesterday. So we thought we would get together and have this conversation. I'm going to do what we did last time. I'll walk you through some of the data from our weekly surveillance report that came out this morning. And then I'll spend some time taking some of your questions. I ask for your patience because I know that the transition back and forth between me sharing my screen and not can sometimes cause the audio to slip out. We're just going to work through that. If that happens, I'll definitely ask you for your feedback before I move ahead here. So with that, you guys see that okay? So you probably all saw the press release that Whitney sent out earlier today. We had more cases reported from yesterday than at any point in time during the pandemic. That's in line with what we've been seeing over the past really 10 days to 2 weeks. Our overall case numbers have come up pretty significantly. Our 7-day rolling average of cases per 100,000 residents was 26.8 for the most recent time period. That's a hefty increase. That's a 54% increase over where we had been a week ago. We're seeing more cases. We're seeing them from all over the county, from West Yellowstone up through Big Sky, Bozeman, Belgrade, Three Forks, you name it. We're getting cases from it. We're seeing cases at MSU. We're seeing cases in K-12. We're really seeing widespread transmission of the disease right now, maybe to a greater extent than we've seen any time during the pandemic. Our percent positive, which is the measure of all the tests that we get results for at the health department here, what percentage of them are positive? You really want that to be below 5%. When it gets above that, you start to get concerned. And when it gets to be above 10%, there's more significant concern that there are cases in the community that we're not finding, that we're not detecting. Our 7-day rolling average of percent positive was up to 8.9%. That's a 27% increase over the 7% we had last week at this point in time. That's significant, and it's moving toward that 10% threshold. That is a greater cause for concern. We're still getting some good news is we're still getting test results pretty promptly. You can see here the blue lines are for each day is the median time from specimen collection to report to public health, and we're getting a really significant number of test results within a day or two, and that's really what we want to see. That gold line, orange line over the top shows the 2-day mark, and you really want to get those test results into public health within 48 hours, and we're continuing to see pretty good results there. Likewise, we're continuing to see that we're able to start our investigation and get people isolated at the health department. Once we get that specimen reported here, we're still, even with the higher number of cases, we're able to get in touch with people. There's a little bit more to talk about here though this week. With the cases that we've been receiving, number one, we're getting more cases. That's one problem. We're also getting some cases that really have an impressive and substantial number of close contacts. That creates that takes time and effort and complication and complicates our efforts to identify those close contacts, get in touch with them, and get them isolated. We're having a hard time really getting in touch with all of the people that need to be in quarantine because they're a close contact right now. We're still doing it, but it's definitely been a challenge. We've definitely had good support from the schools where we've had cases, and they're helping us do it. But we're seeing some degradation in our ability to get to close contacts really quickly. We're still getting people isolated pretty quickly, but because of the number of people that we have who are close contacts, that's creating challenges for us in terms of being able to do that personal interaction. Now, some people are getting letters from school districts, and then we'll follow up with conversations later on. In an ideal situation, when we have fewer than 10 cases a day, we would be having one-on-one conversation with those close contacts, making them aware of resources, answering questions that they may have. That is not entirely possible within the 24-hour period that we'd like to see it right now. And that's definitely a concern. You can see our epi curve from the onset date. And again, this is, for those of you who have been with us in past weeks, this is the date when people are getting sick. The test reports there's typically a delay there because it takes some time for the test to be run and for the specimen to be reported to us. With this, when we do those interviews and we get the date of their symptom onset, we keep track of that. And you can see that now we're seeing in the middle of September, we really had a pretty significant number of people who were starting to feel symptoms. Again, it's really interesting. We saw that spike after the 4th of July, and we're seeing another one after Labor Day. Can I tell you it's completely and absolutely due to Labor Day? No, but I think there's definitely a correlation between these long holidays when people are tending to get together and when we're seeing more cases. But I think this is complex, and it's too simple just to attribute all of it to that. We're also seeing a continued really rapid rise in the number of cases for people who are in their 20s. You can see that started in mid to late September. You saw that increase. You can see it right there. Really significant increase there. What we've seen in the scientific literature and in some reports from other states that have gone through surges like this is that typically or can be followed by increases in other age brackets. And now we're starting to see that here. You can see that 10 to 19 age group that's really being driven by the people who are in their older teens. But you can even see in the 30 people who are in their 30s and 40s, that yellow, you're starting to see a steeper curve there. A week or two past when we were seeing that in that age 20 to in that people in their 20s. We're seeing really significant disease spread people in their 20s. We're seeing a really significant number of close contacts for people in their 20s, and we're seeing people who are coming into contact in a variety of settings, but we're hearing a lot about parties, about gatherings that people are having. And it's not all MSU. This is the latest MSU numbers. The number of active cases we have at MSU is actually down somewhat from where we were a week ago. We're still getting a really substantial number of cases overall. I think we had 40, what are we saying here? We had 43 during the reporting period. We're seeing significant number of cases of people associated with MSU, but it's not, when we're talking about this age category, this 20 to 30 age category, it's not just MSU students. It's really a kind of across the board in that age category we're seeing cases. And finally, as of last night at 9 p.m. when we pulled the data, you can see here where we have active cases in K-12 schools. We have 1 in Anderson School, 5 at Belgrade High. We have 1 at Belgrade Middle School. We have 5 split between the 2 high schools in Bozeman, and then you can read for yourself the others: Morningstar, Montfortin Middle School, and Highlight Elementary. We're working really closely with the schools. It's taken up a ton of our time. This is a complex situation, but we're getting great partnership from the schools. This is a stressful situation for them, for their staff, but I I want to really call out the staff at Bozeman and Belgrade High School in particular. And I'm not leaving anybody out consciously, but Belgrade High School has been dealing with 5 cases, and that's been stressful for the staff, but they've been doing a superb job of working with us and working with parents. And I really want to call out the enormous effort that's been going on. I've heard about principals calling parents directly. Bozeman High School and Gallatin High School, the same thing. It's really been an impressive effort. I'm going to stop sharing now, and then I'm going to pause a minute to make sure I'm getting sound back. Can you guys still hear me? Oh, good. It worked that time. So with that, that's kind of where we are. One thing I want to stress before we get to questions, as we're going through this and as we get more cases and those cases have more close contacts, we're going to have more people in quarantine. And the reason we put people in quarantine is it's just a tried and true method in public health to limit the spread of the disease. If you're at higher risk for developing the disease, and what that means right now is if you're within 6 feet of somebody for 15 or more minutes, we want you to get you home and keep you home so you're not developing the disease and spreading it to others down the road. We know this is hard. We know this is difficult, especially when people may have mild symptoms or in some cases no symptoms. But I want to plead with the public, and I want to plead with those that we're working with. We really need those people to stay home. It's not just an excuse to be off of work or out of school. It really is. We need you home, and we need you taking care of yourself and being careful and staying home. When the health department contacts you and lets you know you're a close contact, that means we really have some evidence that you had some substantial contact with an individual who's a known case, and you may develop the disease. We're also really working hard to support those folks. We have resources. We've built resources in communities across the county to be able to help them if they need food delivered, if they need medicine delivered, if they need help with unemployment assistance, those kinds of things. So I really want to put out a call to everybody out there. We need everybody's help. When you're a close contact, one civic duty you can do is to stay home and really help us limit the spread of the disease. I know that can be difficult, it can be disruptive, but we really need help with that right now. With that, I'd be happy to take some questions if they're out there.
Matt, I have a question. Annie Johnson with KBZK. Can you hear me?
I can.
So just looking at the charts of kind of when you actually see the illustrations of just how much that from these last couple of weeks, our cases have kind of surged, and we've kind of hit like hundreds of cases a day within these last couple of weeks. So in your opinion, what's been the biggest difference from before, when we were first in those early months of the pandemic versus now? And what's it going to take to kind of hopefully get back to where we were with, low numbers?
Yeah, I'm not sure we've had hundreds of cases a day situation. Maybe you're talking about statewide. We've seen that.
Right.
Yeah, I mean, I think it's a combination of things, Annie. I think that you can't really point to any one specific issue. We're not seeing it come out of one specific geographic area, one specific group of people. But what we have been watching for several weeks now is the challenges that some of our fellow Montanans and other cities and other counties have been going through, Yellowstone County and Flathead County and Cascade County in particular, and some of the more less populous counties like Bighorn County, Rosebud County have really been dealing with this for quite some time. Our community has been successful, or had been successful for quite some time, of kind of keeping it at bay for a while. The other thing that I would note is that the states with the highest per capita number of cases are just to our east, are the Dakotas. Idaho has a really high number of cases. Wyoming is pushing cases now, and so you're seeing Utah, you're seeing across the Great Plains and across the Rocky Mountain West a really significant number of cases. And where we had some success because of really hard work and some sacrifice going on here, that can only hold up for so long when you've got cases, really high case counts all around you. And I think that's what's been happening. We have high case counts in the states around us, and we have high case counts in some of the communities around us. And now it's happened here, and we probably shouldn't be surprised by it.
Gotcha. And I have one more question. Yesterday, Mississippi was the first state to actually lift their mask mandate because their numbers are decreasing. And I know that's a little bit different than where we are right now. But could we, I guess my question is, could we expect if our numbers start decreasing something similar, or would more things have to play into part for that to happen?
I would love to get to the point where we can actually ask that question and have it not be theoretical. Right now, our case numbers are going up so rapidly, it's not even something we're thinking about. We really need people to wear those face coverings to help us limit the spread. Someday we'll get to the point where we can tell people it's okay. We're not there right now. I don't know when we're going to get there.
Gotcha. Thanks, Matt.
Hey, Matt, Emma with NBC Montana.
Hi, Emma.
So speaking of masks, I'm wondering if you and the City County Health Department had any response to the anti-mask protesters who gathered outside your office this morning.
Oh, not really. I mean, I know there was a few people here. It wasn't too many. You probably could have put them in a school bus and socially distanced them pretty well. It wasn't an overwhelming number of people. I would say this, I really regard masking as an act of courtesy and respect to those around us. I know that it's become a point of division and that some of our elected leaders are using it to divide people. And I think that's disappointing. I want to point out that we have had 181 deaths in the state, and we have almost that many. We have 177 hospitalized. We've never had more cases in Gallatin County. And we've never had more people hospitalized. We woke up this morning, there were 8 people fighting this disease at our hospital. And so I really regard using a face covering as an act of courtesy and respect. And I understand that some people apparently have a problem with it, but I'm not going to spend too much time worrying about that. We have a lot of work to do. We have a lot of cases to deal with, and we're really focused on protecting seniors and nursing homes and hospitals, and we're really focused on doing what we can to keep our kids in school, to keep MSU operating, because those are things that are really important to our community and to our people.
Is there any concern about possibly more protests like this moving forward? Or like you said, is it just something you're going to keep on doing the work that the health department is doing? And
we're going to keep doing our work. And I'll tell you, as I move through the community during the day, and people tend to recognize me now more than I maybe prefer, but when people come up to me, I almost never get anything but thank you. And I pass that on to my staff because they're the ones that really deserve it. And so I really, mostly we're getting really great support from the community, the people who are reaching out, even the ones that have suggestions about how things could be different are often saying thank you, and they're saying that they understand that we're in a difficult situation. So I'm not really spending a great deal of time worrying about it.
Great, thank you.
Hi, Nora with the Daily Chronicle here. I just want to make sure I had that right. So was the 8 hospitalized, is that like a record high?
I don't think we've had 8 hospitalized since the beginning of the pandemic. No.
Okay, gotcha. And I was also wondering about the situation at long-term care facilities. Can you kind of talk about what they're going through with that?
Yeah, we continue to have cases in a number of facilities. I don't have the exact number at my fingertips, so I can get that to Whitney and get that out to you later on today. I would say a half dozen or so facilities that our team is working with. We really jump on those hard. That's one of the places where we send public health nurses out to help with testing. And we have a full-time person who's working with those organizations, but it's scary. It's scary when you get cases in those facilities, because those people that are in that age category, it really tends to drive hospitalizations and mortality. And so we're continuing to work. I think it's about the same number. We've been somewhat successful in getting the number of active cases down in a couple of the facilities. But I'll get those numbers to Whitney and have them send to you later on today.
And the last thing I was wondering about, were there ever any cases that you were able to trace back to the rally that the vice president had a few weeks ago?
It's very hard, whether it's the vice president's rally or one of the marches that were on Main Street, when we have those those one-time events, we rarely get case reports. So no, we haven't had case reports directly tied to those. Other questions out there?
Hi, Matt. It's Rachel.
Hi, Rachel.
Hi. I had a question about contact tracers. How many people on your team do you have right now? And are you in the process of hiring more to help with the increase?
You know, I'd have to get back to you on that. We're continually adding. We had a couple more onboarded today that came through MSU to us, and they're working directly on our team on the MSU cases. Building, I think when I was in our morning huddle today, there was about a dozen people in the room that were getting ready to go and work on contact tracing. Any given day, depending on how the day shakes out, we've got between 6 and 14 people who are doing contact tracing all day long, and we're doing that 7 days a week. We'll have people here Saturday and Sunday. We're continuously on the lookout. We can when we find people who we think have the time and sort of the ability to do that, well, we keep adding them. And just this week, we've added a couple more. So I don't know exactly how many we have right at this moment, but we have enough. The thing is, at some point in time, no matter how many contact tracers you have so much disease in the community that really what contact tracing is doing is helping you slow the spread. But the contact tracing is most effective at the beginning when you have a relatively small number of cases, and you can really focus on a small number of cases and try and throw a blanket over it and limit spread. That's when it's the best. That's when it really works well. But when you're getting 65, 68 cases a day in a community this size, that's really indicating that we have a substantial number of cases that we're probably not detecting. We're still doing it. We're still working hard. We're still getting those people in one day. But it's kind of like hanging on for the ride right now rather than limiting it. And what we're doing right now is we're able to slow down the growth, I think, of the pandemic, but we're not stopping it. And we're not going to stop it through contact tracing when it gets to be this size. We just have to be honest with people. When it gets to be this size, we need the help from the community. And frankly, we need help from elected leaders. We need help from business leaders. We need help from faith leaders. We need help across the board from people to step forward, be vocal, and say it's time that we really take this seriously. We really wear those masks. We really do social distancing. If you're planning an event and you're going to have a large number of people, we need people to rethink that and really think carefully about how they're going to do that. So when you get to this point in time, we need help from the entire community in order to really limit it. Other questions?
Hey, Matt, Colton from the Chronicle. A little off subject, I suppose, but wanted to ask about, your involvement on the decision-making of high school athletics, because obviously between Belgrade and Bozeman, there's been a couple hundred athletes now that are quarantined just out of contact tracing. And I was wondering just, what goes into the decision to quarantine, or, how involved is the health department on that?
Well, we treat students who are involved in athletics the same as students that are not involved in athletics. It's just a matter that their contacts may be on the athletic team or they might come through practice. And so really, we don't differentiate much. It's kind of like the athletic team is another class or another source of exposure that they have. And again, I had a video call with the staff at Belgrade High School yesterday to answer some of their questions. And this question came up at Belgrade High School. And I said to them, I have provided recommendations to the school districts in Gallatin County about how to do this in a safer way. I'm not saying safe, I'm saying safer way. But really it kind of comes down to, it's a balancing act. You're making, school districts are making really tough decisions about things. And on one side of the scale is the educational value of something. There's definitely educational value in kids being active and being part of a team and competing and being part of that, building self-esteem, all those things. There's a huge advantage to that, but there's also a risk involved in that. And school districts are really weighing that and trying to make decisions about what is the benefit and what is the risk, and they're making decisions in that way. What I'm trying to do is provide the best metrics we can and to show them what the trajectory of the pandemic is right now. And then when we have specific cases in specific schools, working really hand in hand with them to get people isolated and quarantined. And sometimes that involves people who are on athletics teams. And sometimes that involves people who are in math club. Sometimes that involves kids who don't do any of that stuff. And so it really, we don't treat athletes any differently than anybody else. But as the school boards and superintendents and principals wrestle with whether or not it's worth it to have those athletics, we'll be there to share the best metrics. But those are their decisions, and they need to be community-driven decisions. And we're happy to participate in that, but it's not something that I'm going to try and dictate from here.
And let's say that someone involves test positive. How do you handle that from there on? Do you say, you have to only quarantine for 14 days? You have to have a negative test, or, what is your recommendation on that?
So that's not really just my recommendation. We follow CDC guidance. And so if you test positive, the Centers for Disease Control guidance is that you're communicable from 10 days from the beginning of your symptoms. And so Colton, if you became symptomatic on Tuesday, we would start counting from Tuesday 10 days forward. And that's the period of time we would want you isolated. We want you home. We want you to take care of yourself. We want to be checking in on you and seeing how your symptoms are, and you letting us know if your symptoms got worse. In addition to that, we would be talking to you about all of your close contacts. And so if you and Nora and Mira and Rachel were hanging out at a party on Wednesday night, then you guys, they might be your close contacts, and we would talk to them. That's a little bit different. That's where the 14 days comes in. And so if you're exposed to somebody who's a known case as a close contact, not just walking by them in the hallway, and not just walking by them on the street, but you're together within 6 feet of them for 15 or more minutes, you'd be identified as a close contact. And at that point in time, it's 14 days from your contact with the known case. And so if you had that party on Tuesday, it would be the 2 Tuesdays after that your friends would be able to get out of quarantine because of their exposure to you as a case. Now it gets even more complicated, because if you had that party and Nora was feeling ill and she tests positive, she would become a case, and then she's only communicable for 10 days. And so that calculus changes again to 10 days. The bottom line is, if you're a known case, you're communicable for 10 days from your onset of symptoms. If you're a contact of a case, you go into a 14-day incubation period where the case or the disease could develop, and you're a risk to spread that disease at any point in time during that 14 days. And it doesn't really matter if you have a negative test, because you could have that negative test and then develop the disease the next day, and you'd be spreading the disease. So once you're a close contact, you really need to be quarantined for 14 days, unless you develop the disease, and then it kind of resets it in a different way. And every time you get re-exposed to somebody, you start that clock ticking again, because you've been re-exposed and you're potentially, so it really makes sense is once somebody gets exposed, and the other thing is, we don't need people to figure this out for themselves. When I'm talking about close contacts, I'm talking about people that we identify as close contacts when we're doing case interviews with known cases. And they're saying, okay, I had a party, these people were there, or I had, these are the people in my household, or this is my office mate, or this is the person I was in the car with for 2 hours on Thursday. Those are the kinds of conversations. We get that list, and then we contact those close contacts. That's what I was talking about. That process is being stretched out, and we're having a hard time getting in touch with all those close contacts in a really timely way, and that's concerning right now.
All right, thank you.
Yeah. Other questions out there?
Can you said at the beginning there was like a 27.8% of residents, and I just missed the significance of that number. Could you repeat that?
Ooh, let me remember what I said.
Sorry, it was way at the beginning.
Was it 27.8 was the number?
Mm-hmm.
I think that may have been the rolling average of cases.
Okay.
26.8. So we had
26.
26.8 cases per 100,000 people per day. So that's a rate. It's a rate that we do per 100,000 so we can compare ourselves to other counties.
Per day.
So we had been under 10 for quite some time, and now we're at 26.8 per day.
Okay, thank you.
Yeah, you're welcome. That's all on our weekly surveillance report that's on our website. Just for reference, we were at 17.4 cases a week ago when we talked, and now we're at 26.8. So it's some pretty significant growth there. Other questions?
Yeah, I was wondering, do you think we'll see any more business restrictions or any shutdown orders moving forward, or what do you kind of see happening with that?
It's a good question, and it's a hard question to answer because there may be things that we should all be doing differently. I think it's going to take more than the health officer and the Board of Health, though. It's going to take elected officials of all parties, all stripes, and all levels. It's going to take business leaders from all across the community. It's going to take faith leaders. It's going to take a community effort. It's very difficult right now with something as simple as masks causes people to protest outside of the health department. It becomes very difficult to think about going beyond that without real support from elected leaders of all stripes, from business leaders, from the community in general. And I think it's a reasonable question for the community to ask. But it's also really important that we attack this with unity and understanding rather than through division and acrimony. And right now, in the environment we're in, that's very difficult. That's a tough thing to do as we're running into an election and all those sorts of things. So it's possible, but I think it's going to have to be more than health officers and health departments doing it. We really are going to need a unified community effort, and we're going to need everybody to take part in that and to support it and to be vocal about it. Other questions out there? It's like we have one person connecting. Any other questions before we sign off for the day? Okay, I want to thank you all. I appreciate your time. I appreciate you getting on today, and I hope you all enjoy the beautiful weekend we have ahead, and stay safe, stay healthy, and keep your distance from others. Thanks much.